Good afternoon, everybody. We're good to go? Okay. So we're going to have a few phases today's press conference. I'm first joined by Jay Shaw, our Assistant Chief Emergency Management. We're going to be providing you with a COVID-related update. I'm then going to be joined after we've dealt with that with Chief John Lane to speak to another matter in the news today. And then I'll be available for other questions that you may have. So thank you for joining us today. I want to begin, as we always do, by acknowledging we're on Treaty 1 territory in the traditional homeland of the Métis. I want to note that today's, or the most recent update from provincial officials indicate 32 new cases of COVID-19 in the city of Winnipeg. Sadly, 2 additional deaths. 200 cases in Winnipeg over the past 7 days, and a test positivity rate of 3.9%. These are encouraging numbers to see, but we are not through the COVID storm yet, and so I want to use this opportunity to underscore the importance of following the provincial public health orders for Winnipeggers to continue to stick to those fundamentals of washing hands, wearing a mask, and watching your distance. We are also continuing to ask people to stay home as much as possible, and if you have the means, to please support local. The need is still there in our community to support local businesses, and to the greatest extent possible, we want to continue to do so. And we want to just wish Winnipeggers obviously the very best in terms of protecting their own health, but also the health of our community. I want to speak briefly to our libraries. Jay will be providing more information shortly. However, I'm very pleased to see that staff are being called back in so that holds and pickups can be accommodated in all city libraries. A reminder that all public libraries will remain physically closed in accordance with the provincial public health orders, and will only be available for holds, pickups, and returns. The public service is going to continue to explore options on reopening further services that adhere to the spirit of the public health orders. With respect to vaccine priorities, as you know, I've been indicating privately with provincial officials as well as publicly since the early part of December. We've been trying to get further details from provincial officials on the phasing in of vaccines, and have been advocating for essential workers at the City of Winnipeg to be included in those plans. We all know, as media will know, those plans have recently been made public by provincial officials. We are continuing to review and have dialogue with provincial officials, which we appreciate. Glaring omission from those plans include some of our essential workers, including Winnipeg Police Service members, as well as Winnipeg firefighters, as well as other essential workers like transit operators. We're going to continue to advocate to the provincial government for our workers, and we hope to see other essential workers included in the provincial government's plans. Appreciate the dialogue, but those are omissions that we really think need to be remedied sooner than later. That's it for my opening remarks. I'll turn it over to Jay, and then we're both available to answer your questions on COVID-related matters. Thanks. Merci, Miigwech.
Thank you, Mr. Mayor. Good afternoon. My name is Jay Shaw. I am the Assistant Chief of Emergency Management for the City of Winnipeg. Today I'm here to share that we are once again expanding the Winnipeg Public Library's contactless pickup service. As a result, the City of Winnipeg is recalling approximately 77 employees within the Community Services Department who were temporarily laid off last year due to COVID-19 closures. As of March 1st, all Winnipeg Public Library branches will be open for contactless pickup services and returns, with the exception of Cornish Library, which is closed for renovations. Operating hours will be expanded beginning March 1st and will be varied by location. We will have more details on those expanded hours closer to the end of this month. Everyone who is coming to our libraries is reminded to wear a mask, follow signage, and practice physical distancing at all times. Anyone exhibiting COVID-19 symptoms will not be allowed to enter the library branch to pick up their materials. And finally, I'll provide a short update on enforcement of public health orders by our bylaw officers. Since January 27th, they have completed 506 inspections. They issued 2 warnings at separate locations on January 31st related to large groups gatherings at outdoor rinks and not adhering to orders regarding organized games of hockey. The groups were advised that games are prohibited, but they are welcome to skate, take shots, just no games. All individuals cooperated with our bylaw officers. And now we can take questions from the media.
Sean from CBC, any questions related to this update?
Mr. Mayor, with respect to essential workers, I'm sorry, what is the latest communication you've had from the province specifically about the queue on WFPS and WPD officers?
Health officials at the province provided an update to myself, and members of council were invited. There were a number of councillors in attendance, and I really did appreciate the dialogue. We had a good candid conversation about the public plans that the province has released. I'll just say what I indicated was really that glaring omission for groups like the Winnipeg Police Service. We see correctional, certain staff within corrections being included in the phasing, but we don't see any Winnipeg Police Service staff being included in the phasing, as well as firefighters. And so I think Winnipeggers need to ensure that those services are unaffected to the greatest extent possible. We rely on those personnel for our own safety and the safety of our families, and we'd like to see them in the phasing in plans to some extent. And so we've been highlighting that for some time, and we're going to continue to do so to advocate for them and for the overall benefit of our community. Does that answer your question, Sean?
Yes, it does. Thanks.
Okay.
You're good, Sean?
I didn't know how far you wanted me to go back in terms of correspondence and dialogue, but that's the most recent.
Thank you.
Okay, Brittany from Global.
Hi, good afternoon, gentlemen. I'm wondering if you can give us more information on which employees and what areas have been recalled back to work so far.
Yeah, great question. 77 community service employees that work in libraries specifically. The recall is starting today and this week, and we look forward to getting those libraries open for holds, pickup, and return by March 1st. So we still have approximately 400 and so temporary staff laid off that work mainly in recreation and swimming pools, lifeguards and recreation techs and things, job descriptions around that nature. So.
Thank you, that's my only question.
Thank you. Daryl from APTN, did you have any COVID-related questions?
Not COVID specific, no.
Okay, thank you. James from the Winnipeg Sun, anything COVID-related specifically?
Yeah, I'm just wondering, with these lower COVID numbers, are you anticipating any kind of reduction in public health restrictions, and has there been any communication with the province in that regard?
Yeah, great question, James. In communication with the province daily, haven't heard anything on a reduction of health orders. Obviously, that's the responsibility of the provincial health officials. We recognize that we got to do things safely, and we just want to make sure that we're following and being coordinated with their responses so that we can do the best to keep our employees and our residents safe. So we got to take it slow, and we got to keep following the fundamentals. So.
Josh from CTV.
None on COVID for me, thanks.
Okay, thank you. Ryan from the Winnipeg Free Press. Ryan, any questions related to COVID? Okay. Jonas from City TV, any questions related to COVID?
All good on this, guys. Thank you.
Okay, all right, I think we're through all the COVID questions then.
Thanks very much, Jay.
We will let Jay go, and we will let Chief Lane come in, so give us a moment to switch.
Thanks. So I'll just offer some opening comments, and then we'll turn things over to Chief John Lane. Chief Lane, as members of the media will know, is chief of our Winnipeg Fire and Paramedic Service, who probably wants to order some more Purell right now because it's running a little bit low here. So I'll just offer some introductory comments. Thanks to each of you for joining us here today. I want to begin just by taking some of you back to a national magazine that ran a story early in my term, my first term of office, that branded Winnipeg, according to the magazine, Canada's most racist city. And as a community that day and since, we've been, I think, doing our best to address the issues of racism, express overt racism, as well as implicit bias and unconscious bias in as honest and forthcoming manner as possible. And I know everyone, not everyone in the community that day responded favorably when we were as candid about the fact that we have a problem in our city and in all levels of government with racism. We've done a lot of work to date. That work is ongoing and it needs to continue. I want to reiterate what I said alongside our interim CAO, Mike Ruda, last week, that efforts at the City of Winnipeg continue to combat racism in all of its forms. Systemic racism, we know, exists within all levels of government and within every department of those governments. And as mayor of the City of Winnipeg, I'm certainly committed to addressing the issues of racism to the best of my ability. It's an issue that I commend council as well for providing the support and the leadership to do what we can, especially as it relates to education. Senator Sinclair has spoken often publicly, as well as directly with me when I've had the opportunity to speak with him about the way in which we combat racism is primarily through education, certainly unconscious bias and implicit racism. And while the case that we know is being reported in the news today is disturbing to see, the City of Winnipeg commissioned the independent review that's being referenced so the city could better address systemic racism and allegations of racism. This is a continuation of the leadership shown by the city to face these issues head on. Some of the efforts to date include the creation and support of the Indigenous Accord, the mandatory reconciliation training for all city staff, the hiring of a new diversity coordinator, the creation of the what we understand is the first of its kind in Canada, the Human Rights Committee of Council. Some of the work coming out of that committee, members of the committee, I want to thank for their ongoing efforts, including my council colleague, Councillor Marcus Chambers, who has supported the newcomer welcome and inclusion policy. In that policy, it speaks to a city without racism. And as a result, in the coming weeks, training will commence on anti-oppression, including anti-racism and cultural competency. These efforts are incredibly important and will continue to be supported. We'll continue to look at ways to identify and eliminate systemic racism. Part of that process is facing these issues head on and having difficult and uncomfortable conversations and scenarios such as the one we're talking about today. But make no mistake, we're going to continue to push forward. With that, I'll obviously be available to answer your questions afterwards, but we'll pass the baton now to Chief Lane. Thanks.
Thank you, Mr. Mayor. Good afternoon. My name is John Lane. I am the Chief of the Winnipeg Fire Paramedic Service. I'd like to address the continued allegations of racism within the WFPS and information contained within a confidential report that has been recently made public. In October 2020, the WFPS became aware of allegations of racism between members of the WFPS during a response to a medical emergency. These allegations were extremely concerning to me personally and to our executive leaders. This type of behavior is not in line with the values and principles of the Winnipeg Fire Paramedic Service. I want to be completely clear about this. There is absolutely no tolerance for racism or discrimination of any kind at the WFPS or the City of Winnipeg, either among coworkers or while serving the public. Any allegations brought forward are thoroughly investigated and followed up on. This has been the case and will continue to be the case moving forward. That said, we must take an honest look at our organization. We are aware there are issues of implicit and sometimes explicit racism within the WFPS. We know this because issues like this allegation have been brought forward. I want to thank those who have brought forward concerns about the workplace, because it's only with an honest review and open discussions that we will be able to address them. I want to encourage WFPS members to continue to be vigilant and bring forward concerns if they encounter them in the workplace. When these allegations were first brought to our attention, we took immediate action. The WFPS and Human Resources Department of the city worked together to launch an investigation into these allegations. We engaged a third-party consultant, Equitable Solutions, to investigate specific allegations of racism in the field and on social media. It was important to engage a third party because it ensured that we had an independent expert who could provide objective observations and investigation into the allegations. When the investigation was complete, the investigator provided findings. At this point, we follow due process for the employees under their collective agreements. This process is allowed and required for each individual. Our process also included releasing confidential copies of the investigation report and findings to those who are involved in the investigation, including individual employees and their respective unions. As we are now aware, copies of this investigation have been released publicly, though we do not know who decided to break those confidentiality agreements. We have remained committed to keeping these details confidential, not because we are attempting to hide something, but because we know it is vital to the effectiveness of the investigation. We need anyone involved in a workplace investigation to feel comfortable about speaking openly about their experiences without fear. While personal information related to patient care is protected under the Personal Health Information Act and specifics will not be discussed publicly, I want to assure you that in the case being investigated, the Patient Safety Review found that patient safety was not compromised during care, but there were clinical lessons learned as a result of this incident. The investigator also concluded there was no evidence of explicit anti-Indigenous racism in the care of the patient, but that implicit bias likely affected their care experience. The Winnipeg Fire Paramedic Service is responsible for providing emergency medical, fire, and rescue services to all Winnipeg residents. We do not take this responsibility lightly. Winnipeggers need to know that we take allegations of discrimination very seriously, and we act swiftly to address them. To WFPS members, please know, we want to hear from you if you see or hear something you think isn't right. You can always report your concerns to your supervisor or to Human Resources or through the social media email account, or you can talk to me or any leader in the organization. Moving forward, we continue to address racism head-on. The following steps are planned as we move forward. More than 200 WFPS frontline leaders will be required to participate in anti-racism and diversity training. This is being organized right now and will be scheduled within the next month. Additional anti-oppression training is planned for all other employees, and the WFPS has hired 2 consulting firms to assist with a workplace cultural assessment aimed at getting honest feedback from employees about their experience working at WFPS. The third-party consultants will roll out surveys and focus groups aimed at better understanding our corporate culture, and they will provide steps for improvement. And we're ready for questions.
Okay, we'll go to media questions. We'll start first with Sean from CBC.
Chief Lane, can you describe what, if any, consequences for any individual member of the Winnipeg Fire Paramedic Service did happen?
The disciplinary process is ongoing, and that process will involve dialogue with unions. The actual outcomes for individuals are considered to be private human resource matters and will not be discussed publicly.
So for the individuals that were involved in the report, are they back at work and are they working with the public?
Again, the details of those processes will not be discussed publicly, but those processes are underway.
Brittany from Global.
Good afternoon. At the beginning of this, Mayor Bowman, you said you were serious about combating racism in the city. I believe you both have said similar things.
Yep.
This report, as you said, was confidential. If we're so concerned about addressing racism, getting ahead of it and addressing it front on, why not be transparent and release reports like this to the public to show what's being done in full?
Well, a couple things. Firstly, the need for staff to come forward and identify, situations or environments that are allowing racism, whether it's overt or implicit, is needed. And so staff, my understanding is staff were assured that in this process that would remain confidential, and that was the basis upon which information was provided that can now be acted upon. And so, obviously we want to see that continue. I think what would be more concerning is if we, as a city and as a government, didn't ask these questions, didn't hire the consultants, didn't get the independent investigation, and simply told you that there's nothing to see here. Well, look, we know that racism exists in all levels of government, and leaders need to stand up and acknowledge it and need to take proactive steps as we're doing. And I think Canadians should expect that from all levels of government.
Thank you. And reading the report, it sounds like the complainant had made numerous complaints to yourself, Mr. Chief Lane. How do you ensure that people continue to have trust that things are going to be fixed and that they can trust their superiors in this case to take action? And I guess that's a question for both of you.
Well, the trust can be obtained from the fact that that action was taken. The moment any information was brought forward about any complaints, action was taken. And of course, when the report is given partially public in the fashion that it has, it doesn't allow for the full context or the full disclosure of all of the accompanying things that go on with it. So, and as we said, we are committed to the confidentiality of it. We will not be divulging any further information. than what already has been. But when those complaints are brought forward, they are acted upon. And the whole, and I would just also add to the Mayor's comments, is that certainly our intent was to release a summary of the findings without any identifying information. But our intent was absolutely to release the summary of the report. But the manner in which this has now occurred has really violated the confidentiality of that process.
Daryl from APTN.
Hi guys, Daryl Stranger, APTN News. Mayor Bowman, this question's for you.
Sure.
You know, what was your reaction when you first came across this report and this conclusion?
Well, as a matter of course, specific HR matters aren't shared with mayor or members of council. You know, Mike Ruda had provided correspondence to myself and all members of council last week, as has our chief more recently. I guess a couple thoughts. Firstly, it's disappointing anytime you hear of situations where racism is being alleged or described, but it shouldn't surprise us, sadly, because we know that racism exists in a systemic way throughout Canada, through every level of government. What would be more concerning is if we weren't having these discussions, to be honest. If we were telling you there's nothing to see here, everything is fine, that would be more concerning, because you know, and I'm sure everybody that's part of this press conference has seen racism in many forms, in many organizations in Canada. We need leaders within their areas of responsibility to stand up and to acknowledge that racism exists, including unconscious bias, implicit bias. And we need to then take the steps necessary to combat it. And so that includes, you know, prime ministers, premiers, and municipal leaders like mayors. It involves CAOs and department heads, as well as union leaders, to acknowledge that it's a problem that we need to continue to combat. And I take a lot of guidance from Murray Sinclair for what he's been trying for many years to communicate to Canadians, is that the path to dealing with many of these issues are related to education. Yes, workplace disciplinary measures on specific instances are absolutely appropriate, but systemically, education is the way that we combat implicit bias. And so the reconciliation training that we launched for every city staff member, you know, I acknowledge at the time was a start. You know, the work is needed, clearly. And so the anti-oppression and cultural competency training that we'll be launching, it'll be beginning within the Winnipeg Fire and Paramedic Service, is also a really important part of that. And it underscores for me why that level of education and training is required, and why it's important that staff are comfortable coming forward with issues of concern, because they need to be comfortable to raise matters of concern so that we can try to address it head on. I want to underscore what the chief has just said, which is appreciation for the staff that brought forward the complaints. And I would just say we all have a role to play, and we're trying to do the best we can within our responsibilities to provide the leadership that's required.
That's my only question so far.
Okay. Thanks, Daryl.
Thank you. James from the Winnipeg Sun.
Yeah, Chief Lane, I'm just wondering if there are any other allegations of racism in 2020.
I don't have numbers for the department specifically. We did report a total for the city recently in an immediate inquiry, and I apologize, I don't have that number. But I can say any reports that we did receive were acted upon.
Okay. And just a follow-up for the mayor, if I may. What do you mean by unconscious bias and implicit bias?
Look, there's, as has been, at least in the education I've been getting on these topics, which continue, there's overt racism and there's implicit or unconscious bias. I will leave it to others to describe it. My understanding is where someone is treated in an unfair or different manner on the basis of their race or other characteristics, yeah, that's probably not the best definition. We can try to seek it out for you and get you that, but it's more insidious. Like, I have to say, it's more challenging. If somebody comes right out and says something that and is just full-on racist, discipline is a lot easier. It's easier to identify and to combat it. It's that unconscious bias, that implicit bias, that is a lot more challenging, but we know it exists. We know it exists throughout our country, and we know it's going to need continued vigilance in terms of education. And I know the feedback that I've received from members of council, who will also be getting the training that we're talking about going forward, and I'll be getting it as well, because I think we, as Canadians, we all have more to learn on these topics so that we can do better. That was the one area in unconscious bias that was particularly useful in the training. What's your definition of it? Can I ask you? I know you're not the one being interviewed here, so you don't have to get the perfect answer, and I won't quote you. But
no, that's fine. There's just three different types of racism were being mentioned, and I just would seek clarification.
Fair enough.
Just for the sake of simplicity.
Yeah.
Josh from CTV.
Hi, Chief Lane. Whether implicit or explicit, the report concluded that racism did play a role in the timing of the patient's transport in this case, based on her race and based on the paramedic who'd previously raised concerns about racism. So I'm wondering how you can ensure that when people of color, Indigenous people, call for help or in need of help, that they will get compassionate, adequate, and timely care.
The way I can assure that is really by the process that we're going through. That when we hear of accounts that may have involved something to the opposite, we investigate it thoroughly and we take action immediately. I will say that we service over 90,000 medical calls a year in Winnipeg, and this is one incident in those 90,000 that has been that we're aware of. So I think that really attests to the exceptional care that our service provides to Winnipeggers all the time, and that when on those very rare occasions when exceptions to that occur, that we investigate that and deal with it promptly.
And just along those same lines for Mayor Bowman, do you have any concerns about sort of the fallout of an incident like this and the impact it could have on people who do need to call for help and seek care and might hear about something like this and question whether they will get that care?
Yeah, I mean, I just remind everybody that this investigation was initiated by our public service because of a real desire to address these issues head on. As you've heard, disciplinary process is ongoing, And there's, very proactive. This is something that council has led on, education that's ongoing to combat this throughout the city and throughout every department. I know the members of the Winnipeg Fire and Paramedic Service that work hard each and every day will be as angered as I'm sure anyone regarding some of the headlines, but quite honestly, every level of government has issues that need to be addressed, and we're doing our best to deal with it in an honest way and forthcoming way, which is why we wanted to be here to address your questions today. It's the situations we don't know about that concern me the most, to be honest, within all levels of government. We need to have these conversations. Clearly, this kind of investigation was warranted, and we'll continue to do what we can to make improvements going forward. But it unfortunately, in the systemic, when we talk about systemic issues, there's no silver bullet that we can leverage. It takes education.
Ryan from the Winnipeg Free Press. Ryan, we cannot hear you. Do you want to double check your mic?
Hello, can you hear me now?
I hear you, thank you.
Perfect, sorry about that. Mayor Bowman, my first question is for you. I think it was 2019 when there was the investigation into the PPD, Property and Planning Department, and at the end of that investigation, the disciplinary actions against employees were made public. It was announced which ones, the number of employees that had been dismissed, and other actions that were taken. Why is that precedent not being followed here?
Well, as you've heard here today, the disciplinary process is ongoing. In that instance, if my memory is correct, the respective unions were grieving the disciplinary measures that had been enacted. If the unions will approve greater disclosure of that process as it evolves, that'd be great. But we're not there, in fairness, at this stage. It's an ongoing process at this stage with respect to these individual matters. I, for one, favor greater openness and transparency in a manner that is lawful and is permissible within the collective agreements.
Thank you. And Chief Lane, for you, another finding of the report wasn't just that the transportation to the hospital had been delayed, but also that the firefighters involved in this call had agreed upon a common narrative to tell the investigator in an effort to undermine the complaint and obstruct the investigation. And I'm wondering if you can speak to that finding specifically.
As I say, the disciplinary processes are ongoing. We have also committed several times now to maintaining the confidentiality of the report, and I will not be speaking to those details publicly. Those are part of the disciplinary processes that are ongoing.
Jonas from City TV.
Good afternoon, Chief Lane. I know you said you're not going to discuss the confidential information. Can you please just once again state publicly what you can say about this instance and what you are willing to discuss publicly about what we know about how racism played a role in this and where we are right now with this instance?
Sure. To repeat the points that I spoke about at the beginning, it was important that the investigator concluded that explicit anti-Indigenous racism did not play a role in the care of the patient. There may have been implicit bias, The investigator, there were other aspects or other examples of both implicit bias, implicit racism, and explicit racism that were found in various aspects of the investigation, and those examples, those behaviors will be followed up on appropriately with education where warranted and with discipline where warranted.
Thank you for that, sir. For Indigenous leaders watching this today, for Indigenous folks watching this today that are concerned about this message of implicit bias, but no word on discipline or no word really, a clarity on discipline, what can you say to them that are looking for maybe something a little more concrete here?
Well, what I think really the material thing, things that we are doing is to really tackle the educational aspects of combating implicit bias head on. And we are implementing the required educational programs to really inform people of how their views may be implicitly biased. And I would also cite again the fact that we respond to in the vicinity of 90,000 medical calls in the city of Winnipeg every year, and this is one example like this is too many, but this is one example or one event that has been reported in all of those 90,000 calls. So we are committed to providing medical care, fire response, rescue response in an equitable and uniform fashion throughout the city of Winnipeg. And if exceptions to that occur, then we do and will continue to deal with them directly and definitively.
What I would say is obviously the findings that are being reported are disturbing, and they should offend everyone. So let's not shy away from that. On the broader areas, though, I would hope that that folks would recognize that we have not shied away from acknowledging that racism exists within our government, as it does within all governments in Canada and in each of their departments. I'm pleased that the Public Service commissioned this investigation that we're discussing today. This was as a result of the City of Winnipeg's initiative to investigate in a fulsome way. And the ongoing efforts and training, I listed some of them off in my introductory comments, are intended to provide that leadership to combat racism in all of its forms. I have no doubt that additional steps will be required going forward, and we will remain open to hearing from community leaders as well as the union leaderships for respective unions of members we're talking about. As well as from others, what we can do to continue to combat racism in all of its forms. I would be more concerned if you had a government saying that racism doesn't exist, that there really isn't a problem, and trying to dismiss it. We're being honest, and I hope folks can be honest in every level of government. Every organization in Canada needs to be honest that racism is an issue that we all have a role to combating. And we take that very seriously, and I take that very seriously as Winnipeg's mayor.
Sean from CBC.
Report speaks to implicit bias towards the patient, but it also speaks to relationship between firefighters and ambulance paramedics and allegations of implicit bias and racism individuals in those two portions of your service, Chief Lane. I'd like you to address that. There have been ongoing reports of friction, tension, concern, allegations of inappropriate behavior in the past.
Maybe I'll start.
This seems to be yet another one.
What I'd like to hear, Sean, as we're acknowledging once again today, I'd like to hear from the union leaders of those two unions that systemic racism is an issue that that they're committed to combating as well. And I know that the city has and will continue to reach out to respective union leaders to work collaboratively with them to combat racism in all of its forms. But I think all leaders have a role to acknowledge that it's a problem and discuss what each of us are doing within our areas of responsibility to combat it.
I'll add that any examples of explicitly racist behavior is certainly, I think, appropriately dealt with discipline. But the implicit aspects, the unconscious aspects, those are really best addressed by education, and those are the processes that we're undertaking. In addition to that, we are beginning a very detailed assessment of the workplace culture within WFPS through the involvement of two consulting groups that will be undertaking surveys in the very near future to really tackle those sorts of interrelational issues head on as well.
Those be made public?
The results of those will certainly be released to the workforce. That's really what the intended audience is, and the programs we're going to undertake to implement the improvements that are indicated will be undertaken at that point.
Brittany from Global.
Hi, thank you. You guys said that the best course of action to try to fix systemic racism or to move forward and make sure that we can really have some change is to go about training and education. I'm wondering if you can expand on the particular types of training and education that will be going into something like this, timelines, how long that will be, and really what goes into that.
Sure, I'll just talk at a city level. When Mike Ruda and I were in this room last week, we were addressing that head on, and the reconciliation training that was, when we brought it in, it was controversial. The buy-in and the feedback has been very strong. Members of council, myself included, underwent the training. The newcomer welcome and inclusion policy that was initiated by the new Human Rights Committee of Council and supported by Council includes a section on a city without racism, and in that it requires anti-oppression and cultural competency training for all city staff and civic leaders, including elected officials, and so. That will begin rolling out in March, I believe, starting with the Winnipeg Fire and Paramedic Service. I'll be taking the training. Members of council will be asked to take the training as well, and that's very much underway. In the meantime, there's other work for our first ever Anti-Racism Week. The city is leading on, and we're working with Immigration Partnership Winnipeg. So there's a lot of ongoing work to deal with some of the broader, more systemic issues, Brittany.
And I'll just add, and thank you for the systemic question, Brittany. The reconciliation training within the Winnipeg Fire Paramedic Service occupied a very, very high priority. We trained 100% of our staff in either the in one of the two programs, And all of our frontline staff since about 2017 have received the full 2-day program. And it was, certainly for me personally, it was a very evocative experience. I can honestly say I grew up and never heard a thing about residential schools in my education. So it was absolutely necessary, and we made that a very high priority within the service. The other aspects, and certainly one of the easy indicators of systemic racism within our city workforce and within the fire paramedic service is just to look at our diversity. We don't have, our diversity does not, within our workforce, does not reflect the diversity of the city. And there are many reasons for that, not the least of which are the barriers that people must overcome in order to actually become paramedics and firefighters. The cost of schooling, the time required to attend that education, the uplifting and requirement to go to the place of study. So the efforts to seek a more diverse workforce will also really focus on efforts to broaden the diversity of people that we can actually bring into the service, much like the Indigenous Youth Program that we did for primary care paramedic entry, which was underway when I first came to the service in 2014. And that is, we very much want to replicate that effort and others to really encourage Winnipeggers of all heritage to consider the fire paramedic service as a career destination.
Thank you. And is the frontline, this training for frontline staff, is that mandatory?
The reconciliation training, yes. So that has been completed for all existing frontline staff, and as new staff come in, they undergo the 2-day training program. What I will say though, and completed is probably the wrong word to use. The training is never completed. It's a journey. There is no destination where we can say finally, there is no racism. There is no bias. It is a constant journey of personal awareness and identifying institutional factors that create those conditions that lead to systemic racism.
The requirement for reconciliation training, Brittany, is citywide. All city staff, every department, elected officials, everybody. I'm not aware of another level of government that has made that a requirement, provincial or federal in particular, where every single member of the public service is required to undertake reconciliation training, or now building on that, anti-oppression training. And so we're doing that because it's needed. And I think every level of government, quite frankly, should be considering taking similar steps, because I don't think we should delude ourselves in thinking that this is unique to one level of government or one department. Sadly, in Canada, it's not.
Daryl from APTN.
Yeah, Chief Lane, just going back to your previous point, do you have any specifics on how you would bring in more diverse hires?
Well, I'll speak to the success of the, it was called AYO at the time, Aboriginal Youth Initiatives, AYS, Aboriginal Youth Strategy. And it was so it was a collaborative effort between the city's Indigenous Services Department and a number of bands in the province, and they actually sponsored Indigenous youth to come to Winnipeg, to study the primary care paramedic education program in our training academy, to go through the training in the field, and then finally to write their certification exams. And I can't remember the exact numbers. I want to say 13 or 14 people were in it, and I believe we hired 11 of them in the end, and the others went either to work in other places or returned to their home communities to work in that capacity. It was an exceptionally successful program. And we would very much like to replicate the success of that with, again, more primary care paramedic classes and indeed firefighter classes. So now that requires absolutely requires dedication, money, effort, and space. But if we can receive those resources from a number of different parties, then we are very keen to repeat that success.
Daryl, there may be administrative reports that we can get to you as well that have been made public about just increasing diversity in the workplace citywide as well. A number of those reports have come to council's attention in recent years and might be helpful with that question.
Yeah, that'd be great. Thank you.
Gerald, did you have a follow-up question?
No, that was all.
Thank you. Josh from CTV.
While the social media posts certainly formed a backdrop for this particular report and investigation, there didn't seem to be any conclusions made about the allegations about the racist social media posts that were made. Is that coming in a separate report, or can you give us any update on that?
So this, the report was specifically focused on the incident with the patient. The social media posts were dealt with separately, and appropriate action has been taken on all of those aspects.
Can you say what action?
It was a range of actions from education to greater forms of discipline.
Ryan from the Winnipeg Free Press.
Yes. This would be a question for either of you. I think both of you in your comments said that as soon as these allegations came to light, the city chose to contact an external investigator, contract them to look into it. My understanding is Local 911 filed a grievance on October 9th, 2020, requesting an external investigator be hired to probe this matter. Can you provide more clarity on exactly what was the genesis of this external investigation?
Independent of the grievance, it was determined that an external investigator would be the most appropriate mechanism to investigate the concerns.
And one follow-up. In comments made to me, the MGEU really stressed that they have been, in their mind, clamoring for investigations for a while now, repeatedly bringing this up, and in a statement to me said that they felt like these concerns weren't handled as seriously as they should have been by department top brass, and that the situation was allowed to fester for far too long. So I'm wondering if you can respond to that, Chief Lane.
I'll respond by saying that the incidents, any allegations or examples or incidents that were brought to our attention were dealt with, and they were dealt with appropriately according to the appropriate level of discipline for each infraction.
Jonas from City TV. Did you have any further questions, Jonas?
Apologies, guys. I had to star-stick my filter. Chief Lane and Mayor Bowman, just on the overall situation with racism within the city of Winnipeg, we got a number that it was 20 investigations last year that were launched in 2020, and there were 17 concluded with 3 ongoing. Is this correct as far as you know? And for the ongoing investigations, was this one of them?
Those are the correct numbers. I thank you for finding that media release, and I don't know which ones are which.
Did you have a follow-up question, Jonas?
No, that's okay. I just wanted to confirm and see. Thank you.
Thank you. Sean from CBC.
We've been reporting, I think the first time we did a report on the culture of fire halls was 14, 15 years ago. And it spoke, and there were many people that spoke publicly about misogyny, homophobic behavior, racism, and a culture. What I read in this report, exclusive of the taking care of the patient, speaks to culture. And I'd ask Chief Lane to speak to any impression by some people in the public that there is a culture within your fire department that allows this kind of behavior to continue.
Well, Sean, that's precisely why we're doing the workplace cultural assessment, and it is to quantify exactly what is the culture within our workplace. I wasn't here 10 or 15 years ago, and can't really comment on what the findings were then. What I can say that, as far as I know, certainly as far as I've been aware, there was never any formal assessment performed at that time. And so I think that the first step in addressing concerns is to actually measure what the culture is and determine where there is need for improvement.
But if you get an outside investigation and it says directly in it that people that they interviewed attempted to obstruct the information, the investigation by creating a narrative, how do you hope to get a sense of what these places are like or what the culture is there if you've already got evidence that people are going to lie?
I think that underscores the need for individuals to have a safe space to come forward with complaints, and so that we can have honest dialogue with staff about their concerns so they can be properly investigated. And that's something, obviously, we want to see and have an opportunity to hear from staff or quite frankly the public about concerns they have, so they can be properly investigated, discipline can be provided, and systemic issues can be better addressed.
Brittany from Global.
No further questions. Thank you to you both.
Thank you.
Thanks.
Thank you.
Daryl from APTN.
Hi, sorry, I should have asked this in my follow-up last round, but Chief Lane, is there a timeline for the training stuff you're talking about with diversity hires? Is that something that has been started, or you would like to start at some point soon?
Start. From a citywide perspective, we have just, in the last few months, hired our diversity coordinator. And I can tell you that there have been several conversations already with her and with others within community services who are very keen to get these sorts of initiatives underway. But I will say, I will say that you know, a commitment to diversity, it requires funding, and it requires effort, time and space. It is not something that can be undertaken lightly, and just for example, the firefighter training program, that certainly when in my past experience in other centers, that can be in excess of 20 weeks of training. And that's in a full-time residential setting. Certainly the primary care paramedic program took over a year, and so it is a major undertaking.
Daryl, did you have a follow-up?
That is all. Thank you.
Thank you. Josh from CTV.
Hi, on a different topic, if that's okay, a question for Mayor Bowman on Councillor Santos's motion on free bus fare or $1 bus fare. Any initial thoughts on this idea?
Why don't we first wrap up with Chief Lane, and then I can answer that and other questions you might have on other topics.
Yeah, we'll hold you to the end, Josh.
Yeah.
Okay. No other questions from me then, aside from that.
Okay, perfect, thank you. Ryan, any further questions on this topic?
Yes, Chief Lane, you've stressed in your comments on a couple of occasions here that the finding in the report that this wasn't explicit anti-Indigenous racism, but was implicit bias against the patient. When I asked about the finding related to collusion and obstruction of the investigation, you didn't really want to get into it. Another finding in this report was that the conduct of the firefighters that night was retaliatory against the paramedic who had been filing complaints about racism in the department. I'm wondering why you're placing emphasis or stressing certain findings, but not being willing to discuss these other ones.
Because those findings will be dealt with in the disciplinary process, and are not a matter for public discussion.
Has the firefighter who was the main respondent of this probe is a PCP, has this incident and the findings of the report been flagged to the College of Paramedics in Manitoba?
The patient safety review process was undertaken and completed, and that process has ended. The outcome of that process again is not something for public discussion.
Jonas from City TV. Jonas, I see your hand up. It's your turn to ask a question if you want.
Apologies, guys. I'm good. Sorry about that.
Okay, sounds good. Sean from CBC. Anything on this topic?
Lane, you mentioned at the onset that the patient safety event was investigated and it found that there was no risk to the patient. Yet the report itself says specifically in the medical director that an unnecessary delay in transport in this instance was acceptable and it could have been a near miss. Trying to sort out your initial comments from what's in there.
Yeah, and Sean, just so you're aware, your audio is fairly quiet, so I just will repeat what I did say. I didn't say anything about risk, so I said I want to assure you that in the case being investigated, the patient safety review found that patient safety was not compromised during care, but there were clinical lessons learned as a result of this incident. So that really, I think, accurately captures what the outcome was. The patient did not suffer any adverse outcome as a result of what occurred on the scene. Was there potential for that? Yes, and the whole goal of a patient safety review is to, from a just culture perspective, ensure that measures are taken to make sure that those involved understand what occurred so that it can be avoided again in future.
So unacceptable and a near miss, does that in the circumstances of reporting on incidents for WFPS result in action to frontline staff? Like, is there discipline involved in having unacceptable and near misses on calls?
Again, the whole point of the patient safety review is, from a just culture perspective, is to ensure that it never happens again. So and the way to do that is through education. I will say that throughout healthcare, patient safety events are reported all the time, and the whole non-disciplinary aspect of that reporting is what encourages people to report those things. I mean, we follow the same principles as the WRHA, and the results of those patient safety reviews are published on a regular basis. But you see that they are always on the basis published on the basis of what the outcome was, what the patient outcome was, and what the learnings were from that.
Ryan, did you have any final questions?
One final question.
Thank you.
Has the City of Winnipeg contacted this patient to apologize for what transpired that night?
The investigator reached out to the patient as part of the investigation. The City of Winnipeg has not yet done that.
Sean, do you have any final questions related to this topic?
Everybody involved in this back to work?
Again, those are part of the personnel processes that aren't discussed publicly.
All right. Thank you very much, Chief Lane.
Okay, we'll let Chief Lane
Thanks very much.
go, and then we will leave you to the mayor.
As you can see, we don't limit media to 2 questions, maybe 2 hours. But appreciate your patience. I think Josh had a question that we deferred, so perhaps we can start there. Josh,
Thanks.
if,
Yeah, just to refresh.
Yeah, thanks.
The motion on free bus fare or $1 bus fare. Any initial thoughts on that, Mayor Bowman?
You know what, the councillor hasn't discussed the matter directly with me, nor have I seen the motion that you're referencing, so I need to see that before offering specific comment. What I can say is that, you know, the City of Winnipeg has invested tens of millions of dollars more in the most recent budget to support transit. This is as a you know, after the province unilaterally eliminated their 50-50 transit cost sharing. We did receive support from the federal government for transit that was not matched by the provincial government, unlike just about every other provincial government, including provinces of Alberta and Ontario. We continue to invest in transit. I'm really proud that we've recently been able to introduce the first ever low-income bus pass, which is being phased in, as well as for the first time in the city's history offering children 11 and under free travel on Winnipeg Transit. And so there's a lot of work that's gone on recently that I'm really proud of council for supporting. And you know, with respect to additional things that we can do for transit riders within the confines of balanced budget legislation, I'll look at motions as they come forward, but I haven't seen the motion yet.
Thank you. That's it for me.
Okay, thanks.
Sean, any questions on other topics?
No,
Okay. Jonas? Jonas
Hello?
from City, are you there?
Hey, Jonas.
Do you have any further questions?
Sorry, guys. Yeah, no, I'm good. Sorry, apologies.
Okay.
Star 6 me got me in.
And then back to Josh. Anything? Oh, Josh just left, so I guess we're good.
Okay. Thanks. Thanks, everybody.
Thanks, Mr. Mayor.
Yeah, you bet. Have a good afternoon.
Thank you all. Appreciate it.